Acute necrotizing encephalopathy, a pediatrician's worst nightmare. I kept this for almost a year and didn't want to talk about it, but I think it's time to educate the public. Exactly about a year ago, I had a 7-year-old patient who presented to the emergency with 1-day history of sudden high-grade fever, lethargic, and change in behavior. The patient couldn't see the father even though he was just standing beside her. Her conscious level dropped, she fainted, and we had to intubate her to secure the airway. The seizure was refractory and she vomited a large amount of fresh blood. Her influenza A was positive. Patient was very septic with circulatory collapse recurring inotropes. The heart was dilated with poor function. Patient was immediately transferred to a larger center with ICU care and multidisciplines. Patient's condition was critical with multi-organ failure, and the MRI brain was consistent with ANEC. Doctors went all out to resuscitate her, with steroids, IVIG, plasma exchange, tocilizumabs, and dialysis. She survived, but she was no longer the same. At that point of time, we were having influenza outbreak, and I got to know that there were a few ANEC cases secondary to influenza around that region, and some from the same school. All the patients were critically ill, and most succumbed. ANEC is not too common, but the mortality rate can be as high as 50%. 10% of patients who survive are left with severe neurological deficits. Most general public doesn't know about this condition. I hope with my sharing, parents and doctors will start to take influenza seriously.